How to check yourself for pelvic organ prolapse. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. If this is your first Ed Talk, welcome. Maybe this video caught your attention because you suspect that you have a pelvic organ prolapse. Maybe you caught our previous Ed Talks on pelvic organ prolapse. This is a pretty big topic, so we've been breaking it down little by little. We went over the different types of pelvic organ prolapse, the symptoms that you might be experiencing, and conservative treatment options. In this video, I want to tackle how you can check yourself at home to know whether or not you need some more guidance from a professional. Before we get into the ins and outs of how to check for pelvic organ prolapse, I just want to do a quick recap of the three main types of pelvic organ prolapse. So the anterior vaginal wall prolapse can affect the urethra or the bladder or both. You can have a uterine prolapse, or you can have a posterior vaginal wall prolapse, which typically affects the rectum, or it can also affect the intestines. So let's get started. Let's talk about some general information before we dive even deeper. I have a little silicone model here of a female pelvis, and basically what you're going to do is you're going to look and feel for any tissue that might be sitting at the vaginal opening. So here I have this female pelvis here, so you can see the labia here. Then we have the vaginal opening and the rectum down here, or the anus. So what you're going to do is you're going to check to see if you can see or feel any bulging at this vaginal opening. And we're going to talk about the three different positions that I recommend here in just a moment. But what you can do, you're going to start with nice clean hands, and I would recommend have a mirror handy. That way you can see what you're looking at. And what you can do here is just open up the labia, and you can just first check at rest to see, is there any additional tissue there? Is there any pig tissue sticking out or kind of filling this space of the vaginal opening? Okay, so you can look with your mirror, and you could also then stick your finger in and feel for any additional tissue there. So if you feel anything there. Now, one word of caution, just based on some of the feedback I've gotten in from patients as they've come in and said, hey, Justine, I think I have a pelvic organ prolapse, and I'll check them and I'm not finding a prolapse. What I have discovered is that a lot of women just don't know their anatomy, and that's perfectly true, and no shame in that. We just aren't taught this information very well in school, in health class. So when they insert their finger, they're actually feeling their urethra, and it may not be prolapse. It's just that the urethra sits very, very close to that vaginal opening, and so they think it's a prolapse when in fact it's just tissue that needs to be there, is expected to be there. So for some women, I've just reassured them, look, you don't have a prolapse, it's just your urethra, and it's in the spot where I would expect it to be. In addition to checking for prolapse at rest, meaning just like you're just resting there, you can check it with a cough. So it's just a little short burst of increased pressure into your pelvic floor. And then you can also check it with bearing down. With that, I recommend just use a regular balloon. And so bearing down, I've had people try in the past to kind of I'll say, okay, act like you're having a bowel movement, and they get kind of afraid that they're going to fart, or they're going to just something's going to come out. And so what I have found is just using a balloon that you can blow up, and that's going to simulate that bearing down, but you don't have to think about it a whole lot. And you can see with that if you're getting any bulging, if you can feel or see anything there. Okay, next we're going to go over the three positions that I recommend checking yourself in. And again, this is meant to help you decide if you need additional care, additional guidance from a professional. Let's get started. All right, position number one you're going to try to do a self-check-in is lying down. Go ahead and just get comfortable. Put a pillow, maybe two underneath your neck or underneath your head, and you're going to want a mirror. So with here, I would recommend having your knees bent, and then you can just start by looking, okay? And then going over the steps that we just went through. So open up the labia, look, and check yourself at rest. You can kind of feel, and then do a cough and see, does any tissue come down? Can you see anything? Can you feel anything with that? And then also with blowing up the balloon. Now, one thing with the pillows, If you check more lying down, where gravity's not as much of a factor, that's going to be one position. Then what you can do is actually maybe put 3 or 4 pillows up underneath your back, so you're at a little bit of an incline. So that's going to start to put a little bit of pressure down into the pelvic area. And even if you're not finding anything lying down, you might want to do it at an incline. That way you're seeing, okay, is anything changing with that? So give that a try. All right. So position number 2 that you can check in is in standing. I recommend get a step stool that you can put your foot up onto, so that way your legs can be a little open and you can see what you're looking for. So with that, just prop one foot up. You're gonna have your mirror again, and then what you're gonna do is just position yourself maybe next to a wall even, or something that you can hang on to like a chair, and you can look, and then you're gonna open up the labia, check at rest. Do you feel any tissue there at that vaginal opening? And then you're gonna do the cough, again, looking and then feeling, and also the bearing down. So keep that balloon handy and you can bear down. And again, just like looking and feeling. And then the third position is also in standing, and you can try that with a squat. So you can have the foot up, that kind of, again, keeps the hips open a little bit for you to see and feel a little bit better. But again, you can look, use your mirror, and just kind of do a little bit of a squat down and see with that pressure if that changes anything that you're seeing, anything that you're feeling. You can also insert a finger, again, just squatting down and seeing if there's any change there. So there you have it, 3 ways to check what you're looking for when you're looking for pelvic organ prolapse. And if you are finding anything, one thing I want to say is, first off, please don't be hyper vigilant over it. So don't keep checking every single day and be over focused on your prolapse and how bad it is and all of that, because it's not helpful. So I just want you to get a general idea if maybe you have a prolapse, if it needs additional guidance. If so, if you have done this check and you're thinking now, oh no, I think I have a prolapse, I would love to be that trusted source of information for you. We do offer in-person sessions to go over prolapse management, but also online options as well. So please reach out. You can head to our website is the best way to get started, healingspotpt.com. You can fill out a free discovery session form there. What that is basically a free consultation with myself, either via video or in person, and there's absolutely no obligation with that. If you do opt into that discovery session, we'll have a conversation first to make sure that you would be a good fit, that we could help you, and then we can move forward with that consultation. So head there. If you have any questions at all, please don't hesitate to reach out to me. Thanks for watching our Ed Talks.